Hi, my name is Jennifer Wydra, and this is the video that's being completed on the child that I interviewed and assessed regarding the ASQ Ages and Stages questionnaire. I interviewed a 1-year-old female Caucasian child that we will call MC. MC is considered a fraternal twin. Yes, you heard me that right. I interviewed, assessed, observed a twin 12-month-old girl. Let's talk about some implications to social workers of understanding development. Social workers should have some knowledge of trauma. Should also have some knowledge about the ASQ specifically, how to use it, how to apply it, and how to use it as a guide or tool in the assessment process for treatment or interventions. Should also know how it can affect the child, especially when it comes to we need to remind ourselves of strengths and weaknesses of a child. When it comes to MC, she basically was on target for most areas except when it came to problem-solving skills. I'm not sure if it had to do with the fact that she was 4 weeks premature and she also had to stay in the hospital for an additional week when she was born. But there could also be other factors because not every child is always 100% on target for their development stage. During this assessment, I also learned through the interview that was being done by me was that a lot of information was coming from the parents. Sometimes there's pros and cons to a lot of information coming from the parents. Sometimes they can be biased, or sometimes they, for all good intentions, decide to jump in and answer some of the questions, especially if you're interviewing, let's say, an older child that might be 3, 4, or 5 or older, and not realize that it could do more detriment to the assessment process. We should also be aware of a child's limits in the environment that we are doing the assessment in, because that can also have some, without being intended, detriment consequences. Second question, is the ASQ a good tool for the Southwest? This, I think there's pros and cons to everything. I think the ASQ is a very good tool and as a guide. I don't think it should be the end-all be-all for an assessment or evaluation of a child. The Southwest is also considered a big melting pot, and you have to be cognizant when you're doing an assessment of where the child and family comes from. You have to be aware of the environment that you're doing the assessment in. Again, we have to keep in mind cultural backgrounds because cultures are so different. For example, you might have a child that's in foster care versus a child that's not in foster care and lives with their grandmother or their parents. Those are 3 different, very specific scenarios. And the ASQ can give you very different viewpoints on each one. My experience, what I learned from it. This experience was very interesting because in the past 14 years of my experience at DCS, I have reviewed a lot of ASQs. However, this was the first time I have actually completed one. It's interesting being on the other side of conducting an assessment versus just reviewing the paperwork that was done. During my assessment that I did of MC, I probably could have controlled the environment a little bit better. Maybe limited her taking her siblings out of the equation. But I wanted to do it in such a natural setting to see how MC reacts and acts within her own natural environment. So again, there was pros and cons to that decision. Overall, it was a great learning experience. I'm sure I'll be doing more of these ASQs throughout my career as a social worker and maybe at DCS. I want to say thank you for this opportunity and have a great night and have a great rest of the summer. Thank you.